do you want to say? Hi.
Oh, are we taking?
We're live.
Oh, we're live. We're live on Facebook. Okay.
We're not on Facebook yet.
Okay.
Or YouTube or any of those other social media platforms. But hi, I'm Dr. David Warwick of Warwick Chiropractic. Thank you. This is Jose. He came in from a motor vehicle collision, but actually it's a pedestrian type collision. He was hit by a car, referred to our office, and I'm going to let him just briefly share with you what his experience was here. I think I was your first chiropractor.
Yeah.
Maybe, maybe not. I can't remember.
Oh, yeah. Unforgettable. Okay. So, yeah, I did have a very severe accident, and one, I'm lucky to be here alive right now, because I was hit physically. My person was hit by a vehicle in the middle of the night, 2 a.m. And when I got up off the ground, well, before I got up off the ground, I was surprised all my limbs were still intact. But I still had some very significant pain in parts of my body. And so, I waited a while and, ended up reaching out to Dr. Warwick by referral. And Dr. Warwick's been great. He's been very insightful and a good listener.
I don't know about that.
Well, he's very insightful and a very good listener and very knowledgeable about the different parts of the body and recommendations on how to address some of the pain. So what I've noticed is quite a good feeling of relief after visiting Dr. Warwick, but I have such a severe case. It's we've talked about it, and so sometimes injuries can't be totally fixed, but going into the future, knowing how to maneuver yourself, take care of your body better, and some of the exercises that complement the chiropractic work is what Dr. Warwick has advised me upon, as well as his great work, because it helps.
You're feeling a little bit better and able to move.
Yeah, I feel a lot better and more aware of my body and through the chiropractic work he's done.
Awesome. He allowed us to share with you an adjustment of his, so if you don't mind going face down for me, I'll take him through what I do with you, some of the work that I do. His primary complaint was low back, so this is after a series of adjustments. We've been working together. He's moving a lot better, bending a lot better. I'm seeing overall improvement in what we look for as chiropractors and some of the tests that we do as well. So one of the things I look at is looking at leg length, what we call discrepancy or a short leg. And that'll tell us where the misalignments are into the spine as the muscles are contracting or pulling one side more than the other. Take a deep breath in and release. Okay, we're going to adjust sacrum. He was actually physically hit by a car. Did that driver even stop?
Yeah, they did.
They did stop. They were more worried about their car than they were worried about you,
well,
or someone else was.
The person I was with, she was more worried about her car. But the driver stopped probably about 200 feet down the street. I don't think they knew they hit me. Or they were shocked probably.
I mean, and a soft tissue injury and effects. I mean, did you have some fractures after that?
None that were visible through X-ray, but I had noticeable movement and balance issues, which I, as a former athlete, I just never had. Even when I had gained some weight, I still had, mobility, and not after this situation. It changed.
Things changed for you, didn't they?
Yeah.
Now, one of the things is that people's lives are changed by certain circumstances that come their way, and this gentleman has gone on and he's teaching, has obtained his master's degree, and doing some good things in his life. He was playing football. He's also involved in the music industry quite a bit with some some names. I don't even know who. But he's involved in some of the music industry. Let's have you lay on your right side. Bend right here. Head back for me. He's got his Run DMC shirt on. Go ahead, lay on your back.
Gotta have my Run DMC.
Breath in. Breath in again. And out. You've been doing the stretches.
I could be doing them more, but yeah. I want to do them multiple times per day, but I usually get them in once a day.
Do you use the foam roller at the gym when you're trying to do some of the physical training?
Just for, I only use the foam when I attempted to do the squats, but
Right.
that was just for the back of the neck.
Now, Jose actually came in to me much later in the case in working with him.
Yeah.
He already had seen a physical therapist. I believe you did some hyperbaric, had massage.
Mm-hmm.
You were to your primary physician.
Yeah.
What else did you do? Did you do any other therapies or anything?
No, those were pretty much it. Physical therapy, my primary care, you and massage and hyperbaric. That was it. And for people, see, I'm not very, I guess, I wasn't sophisticated in how to move after this situation. So I would just, if I had done it differently, I would have immediately came to, see Dr. Warwick or see people, because I was hesitant because the insurance company of the person who hit me was very quick to want to make some settlement. And I was hesitant to just sign anything without reading, reviewing, or having proper advisement. So, after eventually getting that, then I came and I was advised to see Dr. Warwick.
And all the treatments, I'm sure they all contributed in some end. Which treatment or did they all equally did you feel benefit from?
I felt benefit from each one, and they all, I wouldn't say they were all equal, but they were all complementary of each other.
Very much so.
So the, the chiropractic base, the physical therapy provided great aid to me being aware of where I need to work on, what's weak in my body. And the massage, of course, helps to soothe some of the pain for a couple of days at least. And hyperbaric had a very relaxing effect on me. It was very, helpful in a time of great pain and
right.
Unusual and unexperienced pain in my life. I've been injured from athletics and things before, but never debilitating. Never something that prevented me over a long period of time from doing things.
Purpose of me bringing that question up was to help share with our viewers that when you're involved in a motor vehicle collision, obviously if it's life-threatening, that's an immediate go to emergency room, get you checked out by your primary. But what occurs and how is that case managed from a soft tissue standpoint, from a whiplash injury that's mild, moderate, or even severe or greatly severe? And chiropractic and massage therapy are probably your most primary therapies that you can initially start with, because they're both very passive type therapies, and physical therapy can also be implemented shortly thereafter or within that course of time as well. Once we get the alignment and get the muscles to calm down, and then we can start working on the stretching and strengthening, all bringing them all together. So hope that helps you out. Lift your head for me and back down. Go ahead, have a seat up, face a chair for me. Gotta watch out for the auto eject button.
Go gadget.
Go ahead, bend your elbow right here, drop your head down. Good. Other one. Good. All right, you are set. Any parting words for our viewers?
Yeah, you know, if you want to have a pleasurable experience of being manhandled and you know, get a nice experience. I never have been to a chiropractor before, so I've heard about it and heard people's, you know, stories. I don't know about the back cracking, which I appreciate it. And, you know, I would help people's backs and stuff, give them hugs and cracking their back. But Dr. Warwick, the experience I've had here has been very beneficial for me, and I would definitely recommend to come and meet with him. And he's a person with a great personality and willingness to talk about whatever, you know, issues you're having with your back, and to give you some actual instruction and direction on how you can address it when you leave the chiropractor's office. So from athletes to musicians who are standing up all day, or artists who are standing up all day or in one position all day, they're laying down drawing or sitting drawing. This is a good, I think, reprieve from that daily routine, or however often you're doing that. So I'm, you know, deep into my adulthood and just learning about the benefits of chiropractic aid, and some of my friends are clients as well of Dr. Warwick. So they advised me a long time ago, and I didn't come, but I did come and see Dr. Warwick after being advised to by you know, my lawyer and some other people. So
Excellent.
I had a great experience.
Absolutely. Thank you. It's been awesome working with you.
Thank you.
I'm Dr. David Warwick. Thank you for watching this video. I hope you learned a little bit of something, and you hear it from the patients inside the room. While some of you tend to give your opinions on it, you're entitled to do that. But people are these people are coming in here and allowing you to view their treatment as well as me into this space. So try to keep it clean, and look for our next video. Thank you for watching.